We see a lot of students experimenting with drugs and alcohol, students experimenting with their own sexuality and potentially participating in risky behaviors, risky sexual activities.
We believe that students make poor choices because of not having enough information, not having enough knowledge, not having enough skill, not having enough support to make good decisions.
1 in 5 Boston teenage girls who are sexually active will become pregnant in any year, increasing by 70% her chance of dropping out of school, giving birth to an unhealthy child, and living in poverty. 1 in 5 Boston teenagers is overweight or obese, increasing the chance that he or she will suffer an untimely death. And 1 in 4 Boston teenagers has been offered, given, or sold illegal drugs on school campus in the last year. Peer Health Exchange's mission is to give teenagers the knowledge and skills they need to make healthy decisions. We do that by training college volunteers to deliver our comprehensive health curriculum in public high schools that lack health education.
It's a comprehensive curriculum that enables our students to access information that they wouldn't access otherwise, that we don't have the resources to provide our students or the time to provide our students.
It's a curriculum that starts and ends with good decision making. I think often we forget that part. It's all about, this is why drugs are bad. These are risky sexual activities, but we're not focusing on, and how does your decision making fit into that? So that's a part of Peer Health Exchange that I really find impressive and unique.
When we first come to the classroom, a lot of them think that we're going to tell them what to do or what not to do. We're going to tell them not to have sex or not to drink. And I think that immediately after the first workshop, they know that we're giving them real, honest information.
What we're really trying to do is give Boston teenagers the tools that they need to live healthy and productive lives.
When somebody that's in college is coming and talking to them, that is the person they aspire to be, so they're really paying attention and they're really taking something from that and respecting the information that they're given from that person.
Students feel more comfortable asking a 19-year-old or 18-year-old student these questions about sexual health or alcohol or drugs rather than someone who can't really put themselves in their shoes as well as we can.
I feel more comfortable talking to the college students rather than a teacher.
95% of the teenagers in our program last year have said that they will use something that they learned from Peer Health Exchange to make a healthy decision. 80% have said that they have already used something that they learned from Peer Health Exchange to make a healthy decision.
I saw an absolute decrease in the amount of students that I was seeing with questions, with the very basic health-related questions coming into my office.
I teach the workshop on rape and sexual assault, and that's something that no one talks about. So I think Peer Health Exchange is incredibly valuable in being willing to talk about that.
Our students don't have a lot of experience in identifying abusive behavior, though they know it, though they experience it, though they've witnessed it. It's often after our students have classes in peer health around abusive relationships that students ask for help.
They talked about how if somebody is passing out, they're very close to death because the amount of alcohol that you drunk causes your brain to shut down. That was very memorable because I've witnessed my uncle go through the same thing.
This past weekend, I was with a couple of my friends and they were not making healthy decisions. And they asked me to join them, but I said no because of the things I've learned, and I know that some of the things are highly addicting.
I've heard students anecdotally report back to me, Miss, I was at a party this weekend and somebody offered me drugs, and then I remembered what I learned in Peer Health Exchange and I said, no, I don't really need that, I'm not into it, thanks anyway. When they're choosing to share that with an adult, their pride in their decisions, I think it's really incredible for them to know that they're making good choices.
Teenagers who make healthy decisions are much more likely to stay in and graduate from school, get a job and remain part of the workforce, and themselves go on to have healthy and productive family lives.
Without us, these kids might not have any health education at all.
There would be a lot of unanswered questions and a lot of potentially engaging in some risky behavior without the foresight and without the knowledge that they have with Peer Health Exchange.
It's a really good feeling to know that we're providing all the tools and knowledge they'll need and that we're able to positively impact their life.
Peer Health Exchange enables us to get our students to make healthy decisions in their high school year, to be able to apply to college and then go to college and be successful. We can't imagine running our community without them.